Welcome to Wellness Wednesday. I'm Debra.
And I'm Rachel.
Well, we made it through Christmas.
We did. We did.
We won't talk about if we gained any weight because we all know we ate a little bit of this and a lot of that.
A lot of cake.
Yeah, and but we enjoyed the family time. What a great season. We're coming into the end of 2023.
23.
What happened? This year has gone by.
It has, and it's been an interesting year too. I watched a recap earlier today. There was balloons in the sky.
Oh, wow.
There was a submarine that disappeared and exploded.
Oh, that is true. That is true.
Mm-hmm.
Oh, wow. Well, that gave me goosebumps.
Aliens.
Oh, yeah. Who's to say?
So, yeah, there's been some interesting things in 2023. But there's been some good things in 2023 that happened too. Mm-hmm. So,
I made a career change in 2023.
Mm-hmm.
I moved over to Retreat, Home Health and Hospice,
in
September. So
there's been good things that have happened in 2023. I'm excited for a new change, though. I'm excited for 2024 and
what it has to bring.
For real. That's for real.
You know, we talked about last week, we talked about New Year's resolutions, but, you know, we all know. Mm-hmm. I'm not sure anybody really goes through with them. I try. I really, really do try.
I did see something today, though, that was a really good idea. Instead of just making one New Year's resolution, you make a goal for each month. So the article I read said most people always start out with health care, like their health and things like that in January. And then in February, they move to their house, like what changes they want to do inside, like declutter, rearrange,
I can see
things
that.
like that.
I can see that.
Her next thing in March was finances. So she went from her health to her home to finances. So she picked something different every month each month. She was going to work
That's
on.
attainable. Mm-hmm. What if you miss a month and you double up?
Well, then she said she actually doubled back up in June with her health again to like follow up from the beginning of the year.
See what you're doing. Yeah.
Mm-hmm.
Well, that's good.
It may be more doable.
I'm sure there's other ideas out there from other people. You know, share them with us. We'd love to hear them. What's your New Year's resolution? Do you stick to it? Saving money, whatever the case may be. But, going into the end of the year, let's recap on home health and hospice. With home health, a lot of times people don't really realize that they have a choice. Mm-hmm. If you're coming out of the hospital, in your doctor's office, and, some doctor's offices do have preferences, but that doesn't mean that it has to reflect on what you decide. Right. You can make that choice yourself. All you have to do is say, hey, I would like to try ABC, ABC, whatever. With Retreat, I can tell you with home health, if you're on our home health, we do offer free transportation to and from your follow-up visits, which is a huge benefit, because we're dealing with some of the baby boomers. I missed the baby boomer by 1 year. I'm a Gen X. I don't understand all of this stuff.
I'm a millennial, but I'm a millennial.
Yeah, I'm a Gen X, whatever that is.
But that transportation really does help.
It does.
Because a lot of times I see it more often than not. If somebody's coming out of the hospital, more than likely somebody else has been at the hospital with them and they've taken off work and been there while they were at the hospital.
Oh, that's
but
true.
Now that they're back home and they have these follow-up appointments, they may not be able to drive themselves.
Every one of them.
But their family has already taken off all this time, so they really don't have the time to take off. So our transportation works out perfect for that because our transportation picks them up, gets them there, gets back with them. They actually get them in the building and get them settled.
Yeah, get them to their appointment time.
That is a huge blessing to our patients when they are on service, because everybody at some point in time has been where they needed a ride.
I need a little assistance there. The thing is, I think we're the only home health that does offer transportation with home health. Just give us a call. If you're getting out of the hospital, loved one getting out of the hospital, your mom's been having a struggle, she's got a wound, let's say she's had numerous falls, something's going on, you can request home health from your primary care physician or your mother's primary care physician or your loved one, and they can, reach out and get it set up. We're available to consult at any point in time for that with the family, patient, whatever, in the hospital, out of the hospital. We do take a multitude of insurances.
We take a lot of insurance.
And I'm just kind of briefly go through the list. Like we take Aetna, Arkansas Blue Cross Blue Shield, Health Advantage. I don't know much about them. HomeLink, Humana, Medicare. I don't know what that.
Municipal.
Is that not a
health benefit fund? I'm not really sure.
I think that's a workman's comp.
Maybe.
We'll go to TRICARE, TriWest, United Healthcare, all of the United Healthcare. So it's a multitude of ones that we do take. And we work on getting the pre-authorization on all of that and getting them on service. The nurse goes out and does an assessment and brings in PT, and they do an assessment or OT or speech, whatever the case may be. So, of course, we do infusion in the home. So a little bit of everything.
And we work really close with an outpatient here in town. So if somebody really wants outpatient, but they're not quite ready for outpatient yet, but they still need to work, on their therapy needs, we work closely with another outpatient here in town, or we can work with any
of them. Yeah.
Just to get somebody ready for outpatient, we can actually start at home and then move you over to outpatient. And we have actually done transportation to that outpatient appointment to help transition them back
transitioned
to what their ultimate goal was. So, but home health, there's so many things that you could be on home health for. A new diagnosis, a new medication that you've never had before.
Educating on those, yes.
We see a lot of diabetics that come on that are trying to get their blood sugar right. Knee replacements, hip replacements, just about any surgery that somebody has, you could get home health to follow up with that. Wound care,
IV antibiotics, there's a lot of different things. So the thing is, and also another one is coming out of a skilled facility. So nursing homes have a skilled hall. That's all they're there to do is do short-term, it's just like home health, but it's in a building 24/7. Once they leave that building, it's a great idea to have them set up with home health, because the goal is to keep them out of the emergency room, keep them out of the hospital, and keep them where they're independent. So after your loved ones stay in a nursing home, you can ask for home health. They're supposed to get you set up with home health, but some people come out of go, I don't need that, I've done this. But you do, you truly do.
Even podiatrists, if you're seeing a podiatrist for something and you're wondering if maybe you could do some therapy, or you've had some procedure at the podiatrist that you need some wound care follow-up for. We've picked people up from the podiatrist that needed therapy to help with their stuff. So there's really so many things that home health can help with.
And your insurance takes care of it. It's a good benefit to use, because again, it's going to keep you from going back to the emergency room, back in the hospital, and that's the goal. Nobody wants to stay in the hospital. I mean, I don't.
Or age in place, stay at home as long as you can. Yeah. That's with Retreat, that's the ultimate goal for people. If you're trying to stay at home, we have so many service lines that is our goal for you, is to come into the home and do it at home, so you can age in place there. You're not having to go to a facility. Sometimes it's unavoidable, but that's what we're there for, is to help keep you in your home as long as you possibly can be there.
And another avenue is if you're coming out of a rehab, like St. Mike's Rehab or Encompass Rehab. It is a good idea to go ahead and have them set up on home health. Transition that, because when you're at a rehab, it's a little bit more intense, therapy as far as it goes. But when you get in the home, they need to know that they can manage it in home.
It's a different atmosphere.
Well, especially with setup.
Having nursing care
24/7.
and everybody there and all hands on deck, to going back home and
normal,
expected to be independent.
And you're still weak, more than likely. If you've been in the hospital of any type, I don't know about you, but it wears me out.
Yes, it does.
Especially
everybody involved, family and all. So
so that's another way of reaching out and doing home health, is leaving from a rehab hospital. But we've covered home health, I think, from A to Z, hopefully. Have any questions, of course, reach out to us. We're available 24/7. So, the next one we have is palliative care. A to Z is what we kind of cover everything.
And we've touched on palliative care a little bit. It's still really new for us and to the area, really.
Yes.
So we're still navigating it, but we do have people on palliative care now. And it's more of a transitional period right now to help if we're we really don't qualify for home health, but we're not ready for hospice, but we just need a little extra help at home. We can send nurse in, we can send aide in, we can help with pain management, just to kind of help make your quality of life better. That's what palliative's goals are.
It's that interim in between the two.
Management.
Yeah, to keep them at home, but also give them some care that, you know, can help them along during the week.
And if you're wanting palliative care and inquiring about it, but you've said something to your doctor and they're like, well, there's not really a palliative care here, or that's just hospice, you know, reach out. You can definitely reach out to us and we can help make the connection there. So everybody understands and is on board for what our palliative program offers. It's the same referral process. We get your records. You know, Deb or myself will come sit down and talk with you and go over, you know, what we can offer with palliative care, which I've seen do great things in some families that have not really been ready to make the hospice step yet, but they still needed the help. And if you have a loved one that's not big on the idea of signing up for something where people are going to be coming into their home, palliative kind of helps ease that transition. It starts out slower, and then as the need gets greater, we're able to increase and then maybe make that transition over to hospice. Or, you know, we've actually had a few people that have done palliative in the beginning that their symptoms were all over the place, and we help get those kind of back in line. And then they moved to our home health program, and, you know, we're able to rehab back and do well. So it's just a good program. We're excited about it, and it's a good program. And then, you know, hospice is always going to be like my topic that I'm very impassionate about. But our hospice here in town, it's phenomenal is the best way that I can put it. You know, Medicare regulates everybody. We all are under the same guidelines. Yeah. But it makes a huge difference when you have people that care and
actually have a heart for it.
Do.
Right.
So we have community where we can go into your home and see you at home. And then in long-term care, we go into long-term care facilities and work alongside the long-term care to help with quality of life, because that's what the hospice philosophy is quality of life. And that's not taking your days away. It's, you know,
it's adding days to your life,
actually,
to be honest.
but it is making those days count more. Right. And when we know we have a disease that we can't fix, we want to make sure that that looks how you want it to look. Yeah. As closely as that can. So outside of long-term care and community assisted livings, we go into assisted livings. Any place that you call home essentially
is something we can go into.
We could follow you into and get you care for. And that looks like an aide that comes several times of the week.
You can come up to 5 days a week
to
or
help
less.
With bathing, showering, personal care, you know. And then nurses. Yes. The nurses are like the little angels in disguise coming in there a lot. And you get attached to your nurse.
You do. You want to see the same one. I can speak from experience. I always wanted the same one. You know, and it's so funny because it's not funny. But when you go on hospice, a lot of people go, we won't treat. I said, yes, they do. Common cold, they still treat it. You know, because we don't want that to be a part of why you're having problems. So get on top of that, offer flu vaccine. And, you know, it's not that we're going to make it or speed up. It's to assist and to give quality of life.
And then you have a social worker that will come out, and your social worker is just your advocate. That social worker is going to be doing all they can to make sure that you have all the things that you need, and that all your needs are being met, from the whole hospice philosophy, where we look at how your health feels, how your social is, how your spiritual is.
Mind, body, spirit.
Yeah. And then you have spiritual care. So you have a whole team that's
and volunteers
working for you. You have a nurse practitioner. You have your hospice director. So, and then we have our inpatient hospice unit, which is fairly new. It just opened in 2022. Okay. It's a 10-bed inpatient unit. Staffed with RNs 24 hours a day. Yep. It's a 10-bed unit, so we have 2 RNs for our 10 beds, which are all private rooms, and then 2 CNAs that are there around the clock. So that patient to nurse ratio is very low. So you're getting very
good care. Great care.
Lots of one-on-one time. So We also have a family room there, which we talked about that a little bit.
We did
a
one
few
of
weeks ago.
one of the podcasts.
But there's a family room that's available, so people can come in if they have a large family and maybe they need to come out of the room for a little while.
Have a meeting or whatever the case may be.
It's very accommodating for a large group of people. You could serve a meal there. We have had families come in and have dinner there with their loved one. Over Thanksgiving, we actually had a family. We were able to move into the family room and let them have a Thanksgiving meal there. But there's always refreshments available.
Microwave, refrigerator, you name it.
The unit is always open for visitors. So it's 24 hours a day. If somebody wants to come and stay and be at bedside, if there's multiple people. We've had people bring in air mattresses and fill one of the suites. So, I mean,
all the rooms have their own private bathroom with a shower, toilet. So it's, if your family needs to stay, they're able to get up and take a shower and feel like they're, it's accommodating.
And that inpatient unit is designed for two reasons. So, first of all, we're able to offer respite, and respite care is caregiver relief. So, if you have a loved one that's on hospice that somebody's providing care for, that's what it's designed for. We want you to be able to take care of yourself just as much as we're taking care of the hospice patient. So bringing somebody in respite is caregiver relief, and they come in, they hang out with us for 5 nights, and then they get to go back home. And a lot of times they don't want to go back home, but they,
we've had that problem
quite
a bit.
And then for what we call inpatient stay, or GIP, what a lot of people hear, is if there's a symptom at home that we can no longer get under control. The nurses have been out. We've had medication changes. We've done all the things, and we're still not able to get somebody comfortable. They can come into the unit, or what we would normally call 911 and go to the ER for. After we've elected to go to hospice, we would load you up and take you to the unit, and it would not have to be a let me call LifeNet to get LifeNet there. It's with retreat, you're under one big umbrella. So when the nurses go out, if it's an emergency and they call and we say, hey, you probably need to go to the unit, then our transportation comes out and get you back to the unit. So it's a very smooth process.
A quick process, to be perfectly honest. I've worked for another hospice company, and they have to use LifeNet, and LifeNet is not always accommodating when it's a non-emergency transfer. And that's why the retreat is amazing, because we have our own non-emergency transport that we can come pick you up at your home, all that, and make it so much easier on the family. Less stress is the whole goal for family and the patient.
And it really does, at the end of the day, when you step back and look at the big picture of everything, just talking about the last year, the difference that I've been able to see myself
make a difference in life.
Going into a home with somebody who, the caregivers were burned out, the patient's uncomfortable, they're tired of going back and forth to the hospital. We come in and get them set up on hospice, and their quality of life improves so much. Or, I've even been in situations in the past year where I've been at somebody's home at 7 o'clock in the morning, and they had been up all night long,
God bless,
suffering, and
there's no need for that.
They didn't call anybody. So when they called me at 7 o'clock and I got to their apartment, we were able to get transportation out there within the hour, have them at the unit, and Ricky even made sure when the person went home that they went home to a clean apartment. So they had symptoms that needed to be managed, that they were managed when they left. But not only that, because they had been in such bad shape prior to going into that, they had laundry that needed to be done. Their kitchen and everything that needed to be cleaned up. We were able to send people in to help do that. And even we have hospice patients now here in town that are not able to get a warm meal, and our transportation takes them a warm meal every day. So
I don't know if another hospice can deliver that.
No.
And that's what amazes me, because you can make one phone call to one person and they go do it. And I'm like, oh, wow.
Yep.
I've worked for corporate America. That doesn't happen.
Yeah, so of all the crazy things in 2023, the balloons and the aliens and the submarines, it has been a huge blessing to look back at the things that I have seen and be a part of with retreat. So the patients, it's excellent care. That's 100%.
Well,
You can
my
take-
first experience with bringing somebody into the unit, I was in Atlanta, Texas. Went and did my consult. It was actually for home health. Is basically what it was. They'd gotten out of the hospital and went on home, and I was going out to do the consult for home health. I got there, and the gentleman was beyond home health, and he was in a lot of pain. I made one phone call, and we were able to get him to the unit and send him home comfortably with no pain.
Riding a bicycle now.
I know,
You're right,
but I
bicycle.
mean, you know, the thing is, he's still hospice appropriate because he does have something that's terminal. But when I met him, he was rocking. He was in so much pain, and I knew I couldn't leave him. I gave him, you know, here we can go to the emergency room, or I can get you on hospice. And he goes, "What? You know, hospice? I'm not dying." I said, "Well." He goes, "Well, I am, but not right now." And I said, "But I'm not trying, we're just trying to get your pain under control. And how we can do that is that you can go to the emergency room and spend however long you want, or I can get you sent to the inpatient unit. And I can almost guarantee the second choice will be the faster choice." And sure enough, literally the next day or the day after, he was playing the piano at our unit.
Yep, he let us share it on our
So,
Facebook
yeah,
page.
I was just amazed because it wasn't the same man that I met. I was wanting to cry because he was in so much pain, and I didn't know what to do. I was pacing, going, "Oh my God!"
So after hospice, we talking about the inpatient hospice unit is actually located inside of our assisted living, and that's called the Retreat at Kenwood, which is an aging in place facility. So when the residents come in, they're able to spend, you know, the rest of their life there if that's what they choose
to. Yeah.
So they get to age in place there. So it's not like at some point if they weren't able to do their own ADLs or something like that, then they would have to go into long-term care. They actually get to come in and be there. It's 5-star is the best way to put it. The care there is just 5-star.
Yeah, it is truly.
It really is. The food is good.
Oh my gosh, Mimi's an awesome cook.
Man, that food, she can throw down in the kitchen. And
her dressing.
You walk in, it's very clean. It smells
amazing.
good. Some of the best staff that you can find in the area are in there. They care. They, you know.
Friendly. Oh, extremely friendly. I'm like, wow.
They are friendly, but they love on those residents like they are their very own. So it is a big umbrella retreat. It has a very large
a little bit of everything.
Even if you are 60 and older and need a primary care doctor, somebody to follow, somebody to see, we can help with that. Yeah. Andrea over at the Texarkana Senior Care Clinic, we work with her
really well
daily, and we're able to set people up and get them in with her to establish as a new patient if they don't have somebody, because you see that a lot. You see people who go a long time without going to the doctor, and then they end up in the hospital
and they don't have that established any longer. So we're able to do, you know, get them in to see her pretty quick.
Yeah,
like the next week.
Even help with transportation.
We can do that too.
There, so and Andrea is known to do some home visits. She goes above and beyond. She'll go out and see those people. So, I mean, I trust her with my own family. She's the best. She's
actually gonna, I'm gonna set up a time. I'm actually of the age that I can go to her. She is not. So I'm gonna move to her probably after the first of the year. You know, because I'm reaching that age. I need a little bit more TLC. Things are breaking. I get up a little slower. So, but you know, that's just a recap on everything that Retreat Healthcare Services provides to our community. Again, your insurance will cover it. Your hospice is 100% covered by Medicare. It's or under the Medicaid umbrella. No out of pocket. You won't get pocket expense. You won't get a bill from us. So it's something that is, you know, if you're afraid of that, then let me ease that. It is not going to cost you.
Right.
So,
and being a nurse and being in healthcare and working, you know, for several different facilities and in and out, a lot of times you see where a therapy group doesn't actually work for the actual company. It's a contracted out therapy group that comes in. And the good thing about Retreat is that our core therapy group here are Retreat employees. They don't work for another company. No. They actually work for Retreat. So they're involved in everything. They're involved in, every meeting for a home health patient, every hospice meeting for a home health patient. Mm-hmm. So it's really nice to be able to have your core group that's available all the time. Somebody that, you're not having to jump through hoops to get somebody. You have them right there. So
or checking with, see if they're available. They're available. It's just a great company to be able to say that, they take care of our community. And I 100% believe that.
I really do.
It's amazing.
It is.
It has been a breath of fresh air. And I've been around for a while.
Have you taken your Christmas tree down yet?
God, no. You're not supposed to until January 6th. You're going to have bad luck.
I know. What is the theory behind that?
It has to do with the birth of Christ. It's so many days that you're supposed to.
12. So
Thank you. Okay.
I had it all wrong. I sang y'all the 12 days of Christmas a few weeks ago. Mm-hmm. The 12 days of Christmas is not before Christmas.
It's after?
It's after Christmas. And the 12 days of Christmas is the gifts. It's like representing the gifts that the wise men brought or the Magi, which is what the Epiphany, January 6th is. So that's when the 12 days of Christmas starts, and I had no idea.
I don't think anybody did. Well, thank you for finding out.
So I have
She's a research person.
I do know that now. So all this, the past, I'm not saying how long, years of my life, I've been singing the 12 days of Christmas
on the 12th
Christmas, but it's not. It's
after it's the birthday.
So it makes so much sense.
I knew that January 6th was
the
that.
Little drummers drumming for the little drummer boy and the gold for the 5 golden rings. So all those gifts make sense now. Totally makes sense.
But it's bad luck to take your tree down before January 6th. Don't do it.
Of
course, I would go to February if it was me.
I will take down all of my trees except for my main tree. Like my living room, my big main tree, it'll stay up, but the others will probably start coming down now. Mm-hmm.
Nothing's coming down. It took me too long to get up. Literally, I was decorating the day before Christmas Eve.
That's okay.
We had family over on Saturday before Christmas Eve, but it was fun. So tell me, what was one of your favorite gifts you received this year? I know that's hard.
Honestly, people always laugh at me when I say this, but my favorite thing is the gift of time. So I did get a whole lot of really good gifts. Like everybody did me really good this year. But at the end of the day, it means more to me that somebody will come spend time with me than to give me something.
To give you something.
So I did have a house full. All weekend long, my house was full. So my heart was very happy the whole time. So, yep.
That is sweet.
Definitely. What about you?
Well, we, my husband's family, his mother passed away in 2019. So we get together, usually at Christmas. And normally after she's passed away, they come to my house. And this year it was on a Saturday before because his brother lives in Baton Rouge and then sister and other brother lives in Texarkana. So we had about 20 people at our house Saturday night. It was fun because we don't always get to see them, but we enjoyed it. But my favorite, my husband, I've been married 36 years. So, the first couple of years, he wasn't so great at giving gifts, but he's learned. And one of his things he said this year, he goes, I paid attention. I listened. And I'm like, oh Lord. And I really had a huge box behind my tree. And I'm like, Lord, what advice? And I say things just spur of the moment. If you know me, you know me. So I guess 7 months ago, we're having a conversation. I don't know what it was about because I'm always going, I want to do that. I want to do that. Knowing darn well I'm not going to do that. Well, apparently during that time, I told my husband I want to learn how to play piano. And I'm like, I did? He goes, you did? And I go, oh, I got a keyboard. So I guess I'm going to learn how to play piano.
Playing for us.
Oh, Lord. I got to YouTube it and learn it.
Yeah.
Somebody's got to teach me because I am an old dog.
We will do a music special.
I just looked at, you should
be
see.
the star of the show.
Just see my face. I go, I did? Oh, I'm excited. Then the very, very, very big gift was, so my husband on Mother's Day one year got us these electric, I called them tricycle because they were so small. We looked like giants on them. Oh. And we would go camping and we'd ride them. And we looked like overweight people riding these little bitty tricycles. And I'm like, I can't do it. People are pointing at us, so I kind of didn't ride it anymore. So this year he bought us life-size electric bikes. I'm going to have to get extra insurance.
Or a helmet.
I almost killed myself on the little one. Can you imagine what I'm going to do on the big one?
Oh, you're going to have to have a safety helmet.
No, it's going to be a mess. I mean, neither one of us are coordinated enough to get down the road. And I go, Gerard, he's going to take care of us when we fall and break something. Mm-hmm. Retreat. We're going to be on their home health before long.
Going to have to be.
So, but it was fun. But my daughter, God love her. She is one of the most organized individuals. She tries to organize her mother. Lord knows she does. So her gift to me was a thing for my car, because if you ever ride in my car, I go clean out the front seat with all my business stuff, throw it in the back seat. So she got me this cute little thing, and it says today's plan, ideas, to postpone. I'm surprised that's not filled in already. To do and to buy.
Oh, that should have been more than one little thing for
I know, but memo for everything. I thought, oh, okay, thank you, honey. She goes, well, you always say. I go, I do, but I always have a things to do list. So now I have it for different categories.
And sticky notes.
And sticky notes.
I have ADD, not ADHD. But I have to have sticky notes. That's how I operate a sticky note. So
I do, and then I'll start a new note, and I'm like, what did I do with that old note?
Mm-hmm.
So, and coming out of working in an office from being in long-term care to my office now being my car. I mean, I have an office here, but my car is my primary. Sometimes those sticky notes, if you slam on the brakes, or paper, it goes sliding. I'm like, oh Lord. So
mine are always stuck by my radio or on my dash, so I get in and I see it, and once I have taken care of it, then it goes away. Mm-hmm. So that's a big deal for me. Don't touch my sticky notes.
Well, mine is, I usually have a container in the front, but with my driving, which you've ridden with me, I may slam on the brakes 1, 2, 3, 100 times. And for some reason with leather seats, everything goes to the floorboard. So I got to figure out a way to put the seatbelt around it so it doesn't end up in the floorboard and everything everywhere. But yeah. But I had a great Christmas. My daughter is working on me getting organized, and I'm going to learn how to play piano, apparently. I got to watch what I say to my husband, because apparently he is paying attention.
Right.
He's observing what I say.
Well, we have everybody coming back over for New Year's Eve.
Oh, Lord.
We will have nachos, like a big old nacho spread.
I remember you doing that.
And I'm doing it again this
Oh,
year.
wow.
And one of them got a league-size ping pong table, so we're going to move furniture and play ping pong inside.
I have a ping pong table.
Instead of outside where it's not cold, so we will have I'm a little worried, actually, because
Things might get broke, because if you hit it really hard, it can hurt you.
Mm-hmm. And I have a very competitive
I can imagine with your boys.
So
yeah.
I didn't do board games this year. I did card games. So everybody got a new card game to play, and my daughter-in-law and my other son's girlfriend, they sorry, suckers. They give me a hard time, because when I first started playing cards a long time ago, there was only a line under one, either 6 or 9.
Oh, that is true. That is true.
And now they put a line under one and on top of the other. What sense does that make? So, me...
You're trying to maneuver.
Unintentionally thinks that I'm on a roll.
And it's the wrong number?
Yeah. So, and they called me out on it and accused me of cheating. I wasn't cheating. Who changed things? No,
we cannot play Uno at our house.
No. So, yeah, we have Uno that we'll be playing, Skip-Bo, Phase 10, and a new one called Rook, I think.
I don't know that.
And then Rummy and Spades, probably. So, it'll be a good night.
Well, we don't play Uno because my husband says I'm too... Because you're supposed to say Uno when you get to the last card. He never remembers. And I'm like, caught.
Well, and they changed which I'm sure it's like that with everybody that's younger now, but they changed the rules on
No, I don't want to play them.
So when I played back in the day, if you had a draw 2 that you laid down, that person just drew 2.
Right.
And they move on.
Right.
Well, now,
there's a new
if
rule.
you have a draw 2 and the next person has a draw 2, then you just keep laying your draw 2 down until the poor unfortunate soul that doesn't have the draw 2.
That's how we play it.
Oh, I never played it like that, but now, I mean, that's intense.
It's
get to
vicious.
the point that somebody's drawing
vicious,
6 or 8 cards at one time. That's not
no.
That's not cool, and it always ends up being me. So
that's why she didn't like it. Well, my New Year's Eve is probably gonna be very quiet because my husband's on call, so we'll probably be at our house. Not gonna lie, probably sleep by 10. Wake up about midnight. Happy New Year. Mm-hmm. And hopefully the new year brings in a lot of blessings for all in our community.
Y'all eat all the extra stuff for me, because I don't eat black eyed peas and I don't eat cabbage.
Well, we usually
I can do cornbread, but I like pork chops and like things like that. You gotta
eat all the things that bring you
I can't do it, so y'all just have to eat some extra for me.
Oh no, we normally go to my brother's house, but he hadn't invited us this year. We may be off the list, but we go over there and have our New Year's where we have the cabbage, the black eyed peas, all of that good stuff.
Yeah.
just to be on the safe side. You never want to be, I'm going to go ahead and try it. And I'm not a black eyed pea eater.
I do, though, however, I don't wash clothes on New Year's Day.
I did not know that.
And I don't sweep, because you're not supposed to sweep on New Year's Day either. You'll sweep all the way. So I
can be lazy.
Try that.
Look, I'm going to be lazy then.
I at least try that.
So New Year's Day, you do not do laundry. You do not sweep.
And I also saw something this week where you're supposed to open your door right after midnight. So you let the old year out and let the new year in.
Oh, the ghost of the year.
I just saw that, yeah.
How interesting.
Yeah.
Wow.
But,
Well, that's your Wellness Wednesday with Deborah and Rachel.
Yeah.
And we wish you a happy new year, a blessed new year.
Yeah.
If you ever need us, we're just a phone call away. Give us a call. We'll come out and visit with you or wherever you may be. So have a happy new year. Be safe.
And we'll see y'all next week. Bye.
Bye.
Choose excellence in healthcare. Choose Retreat Healthcare Services.